discorder was present, and in her initial treatment with with Dr. Bonnie Jacobs, which I believe started before she began dating Mr. Depp, she had indicated to Dr. Jacobs, according to Dr. Jacobs' notes, that she was having repetitive nightmares back then and that they were related to her childhood trauma. And so that came up several times in the notes. Dr. Jacobs kept mentioning that.
Thank you. What is feigning?
Feigning is essentially faking or exaggerating symptoms that aren't present.
Does the CAPS-5 control for that?
It doesn't necessarily control for it, it can expose it by drawing out.
How does that work?
Because you're not just simply handing the person a checklist that says, here are all the symptoms of PTSD, why don't just check off the ones you have, which clearly if you're trying to look like you have PTSD, you would just check them all. The CAPS-5, because it requires them to describe in detail how they experience the symptom, where it shows up, what it looks like, what sort of examples they can give you, how many times it's happened in the last couple weeks, how many times it's happened in the last month. By the end of each symptom, you've gotten a very good picture of a couple things. One, does it meet the definition of the symptom? Are they getting it right? Is this actually the symptom, or are they kind of confusing this with something else? Number two, are they giving you very vague accounts? Are they giving you kind of a stereotyped idea of what the symptom is based on media or movies or something that actually is completely different from genuine experiences of this symptom? Or are they giving you a very genuine, heartfelt, sometimes minimizing, but it's ticking all the boxes, their mannerisms while they're describing it, the actual very specific, very nuanced, symbolic ways they're describing it. A lot of times it smells, it sounds, that all appears in genuine accounts, and it's
nostalgia.
When feigning.
In addition to the conclusion that Ms. Heard does not have PTSD, you can make a conclusion with respect to her symptoms?
Yes, actually I did. So, just because somebody doesn't have PTSD doesn't mean that they weren't harmed psychologically by whatever is being alleged. In this case, Ms. Heard is alleging that she was psychologically harmed and that she suffered PTSD because of abuse that she alleges occurred by Mr. Depp. So the MMPI-2 is helpful because it shows you kind of everything, any other symptoms, and then in Ms. Heard's own self-report and her prior treatment records, I knew that she reported to me that she had had some other symptoms. So now what becomes really important is determining, and let me clarify one thing here, not so much a diagnosis, but did she start to experience symptoms during the relationship and after? Did they worsen after? Or could these types of symptoms or reports be explained by other factors? A, by feigning, B, by pre-existing conditions, or C, by other stressful life events that might have occurred. So the main symptoms that I was looking at didn't meet criteria for PTSD, right? There was also, substantial evidence of this sort of emotional dysregulation, emotional disorganization, the shallowness, the dramatic affect. Now, when you have a lot of childhood trauma, you can actually have some similar type presentation in adulthood. There are some differences though, but also that's not something that would have occurred after this relationship. So now I was looking at, are there indications that these types of things that she's described, this transient anxiety, the issues with sleep, were these there prior? And sure enough, Ms. Heard, in her own self-report, stated to me that when she first got to LA, she was seeking treatment for, in her words, blanket anxiety and depression. She also reported that she was taking medications. In general, none of them were helpful. That's actually very typical of borderline personality disorder. Medications typically aren't very helpful for somebody with a disorder. They really need an intensive, lifelong type of therapy, which is not necessarily as relevant to this. But interestingly also, people with borderline personality disorder often respond really positively to stimulant medications that are given for ADD or ADHD. And in one of Nurse Filati's notes, she reported that Ms. Hurd told her that none of the medications were working for her except for one for visual, which is often prescribed as stimulant medication.
That's what
And
I
I
take
just
for
thought that
multiple
was interesting
sclerosis,
for
and I'm not
consistent
taking it
with
now.
Lifelong personality disorders.
I only take
that
it
aren't
after
necessarily caused
treatment
by a harm
because
by
the
any
treatment is
medications,
crazy.
but have been there and will remain there typically. The other issue, so the anxiety, she had already indicated that had been there prior, but the form of the anxiety, so looking at Dr. Hughes's testing and then also looking at the scores on the MMPI, you look at all these little combinations of the scores, you can actually learn a lot about, is the anxiety related to an event, or is this more a person who tends to be an anxious person regardless of what's going on in their life? And somebody might describe them as a worrywart. And the scores, the little combination of scores that she obtained actually indicated that it was the latter, that her anxiety tends to be separate from events and more just kind of a constant, and it comes and goes, but it's more of a trait.
I have no further questions for this one.
All right.
Uh-oh, cross-examine.
Let's go ahead and have our lunch break. Might be a good idea to break it up there. Okay, I know. I can see you jumping up. All right. Ladies and gentlemen, let's go ahead and take our lunch recess. Just again, do not do any outside research. Don't discuss the case with anybody, okay? We'll have you back here.
All right. Well, that was nuts.
And again, Dr. Curtis, ensure in the middle of your testimony, please do not discuss your testimony with anybody this time, okay? All right, let's just always come back at 1:50, okay? Come back 1:50? All right, thank you.
Okay, I hate that noise. All right, well, I guess I'm going to continue putting on my makeup. I will be back in a little while. Once the trial starts, we'll go for the second half. I mean, this is the part I was waiting for. The medical assessment. All right. Let's go do a load of laundry. It is 20 minutes of 10. They are at lunch probably till... Alexa, what time is it in Virginia?
In Virginia, it's 12:42 p.m.
So in an hour, so 1:42. All right, see you guys in a little bit.